Will democracy survive the next couple of years?
And essentially we are the same.
And there are so many needs that Minnesota has.
What people are saying they need right now.
Access to Democracy is made possible in part by a donation from Firefly Credit Union. Firefly is the new name of U.S. Federal Credit Union, which has proudly served the financial needs of the greater Twin Cities community since 1925. At Firefly, we guide our members forward and give them the power to chase dreams by delivering the financial solutions they need to get ahead. From checking accounts to mortgages, we'll light the way. We are Firefly Credit Union, and this is life illuminated. By Thomson Reuters, providing legal professionals with intelligence, technology, and human expertise they need to find trusted answers. Thomson Reuters, the answer company. Online at thomsonreuters.com. And Dr. Charles Crutchfield of award-winning Crutchfield Dermatology in Eagan. Acknowledged as one of the nation's best physicians, a Minnesota native who trained at the Mayo Clinic, Dr. Crutchfield personally treats all patients and states that experience counts and quality matters. Crutchfield Dermatology, look good, feel great, with beautiful skin.
Welcome. Access to Democracy returns. Alan Miller with you. A first-time guest, probably should have been a guest a long time ago because we haven't talked about eyes too much on the program, but Dr. Jeffrey Stevens is the president of Edina Eye Physicians and Surgeons. And what does that mean, that you're the president?
Well, it means I have a combination of hats that I wear. Of course, my first and foremost is a physician and taking care of patients both in the clinic and surgically. And then there is an administrative role with helping out with the leadership in board meetings and some of the behind-the-scene ongoings with the practice.
So being the president, you don't get to assassinate people in other countries, though.
No assassinations.
Now, Edina Eye, which is one of the bigger outfits in terms of ocular activity in this Twin Cities area.
Right.
You have about 6 offices?
We do. We have 6 offices, mostly in the south and western suburbs. We do go as far north as Princeton and Elk River, but also have offices in Waconia and Chaska, Shakopee, Burnsville, and Edina.
And about a year ago, you merged with another ocular, or
correct?
Right.
Yep.
North Suburban Eye?
Yep, we merged just over a year ago and had a divisional merger with North Suburban Eye Specialists and formed the divisional merger which we call Twin City Eye Consultants now. And basically doubled the size of our group, and we have just formed a beautiful relationship with their practice and their ophthalmology group, and we're looking to continue to expand.
So how many doctors are we talking about?
In our practice right now, I believe we have, I think we have 5 MDs and 2 doctors of optometry practicing in our group. And then North Suburban Eye Specialists, I believe, has 5 as well, medical doctors, and I think they have 4 to 5 doctors of optometry as well. So, so
you hop from office to office?
I do. I hop from office to office in the Edina Eye Physicians and Surgeons practice. Most of us go to probably 3, maybe 4 of the offices. We don't all go to all the offices. We try to keep some consistency in the area that we are familiar practicing in.
And then you get everybody together for meetings and things like that?
We do. We have board meetings for our South Division of TCEC, which is the Edina Eye practice, and then we also have combined board meetings with the TCEC group as well, and those, occur usually monthly.
Now, when you take a vote, do you say the ayes have it?
We've never had to say the ayes have it yet, but there are lots of eye puns that go around quite often. Yeah.
And I guess things that people don't know about you, which even I didn't know, is that you were a baseball pitcher of some repute. You actually had a scholarship to
Baylor University. And yeah, some repute would probably be an overestimate, but yeah, it helped pay for some of my schooling, and it was a great opportunity to play baseball in what then was the Southwest Conference. So it was all Texas schools with Arkansas, and there was some very competitive baseball. We played with a lot of guys that went on to play in the majors, and clearly was over my head, but it was fun to compete at that level.
Your father was in the Baltimore Orioles chain, though.
Correct.
And your brother was actually offered a pitching job by the Twins.
He was. He was drafted by the Twins and went on to pitched at the University of Iowa for 4 years. And I admittedly was the least talented of the 3 men in our family. And but yeah, pitching was a big part of our family. And my dad was
better you're where you are now, though.
Yeah, I'll take my position now any day.
But you are a Twins fan simply because you have twins.
Well, Twins fan, yes. Because I grew up in Minnesota, I do have twins, as do you, and it's a special bond having twins for sure.
It is.
Yeah.
Especially when they're fraternal and they don't agree on anything and don't even necessarily get along,
right,
as mine don't.
Right. And, we love and celebrate their differences, and they don't always celebrate them as much as we do. But they're 2 unique individuals that don't want really to be associated with anything the other one does necessarily. But they're great girls and love each other.
Now we talk about ophthalmology. What exactly is ophthalmology?
Well, ophthalmology is if you break the Latin word down, the study of the eye. And ophthalmology is a practice that, in order to become an ophthalmologist, you spend 4 years in medical school, you get your medical degree, and then you apply for residencies that do the eye training. You do 1 year of general training after medical school, and then you do 3 years of ophthalmology specific training, and you can always do more specialized training to subspecialize in the field. I chose to do the 3 years and become a comprehensive ophthalmologist, and so my day consists of probably 60% of the time being in clinic, seeing patients, helping with eye diseases, taking care of the routine things as far as this first pair of glasses for an 8-year-old to a 95-year-old who suffers from glaucoma and everybody in between. And then the other probably 20 to 40% of my day is spent doing procedures or surgery.
And those procedures, a lot of them have gotten much easier since you first started practicing.
Correct.
We hear about laser surgery.
Yeah.
And what would you do laser surgery for?
Well, it's pretty exciting in the field right now that there's so many areas that laser has expanded what we can do for patients. I still have a lot of patients who come into my practice who remember taking their father or mother into the ophthalmologist and to have cataract surgery 40 years ago, and that involved a week in the hospital and sandbags over their head, and ophthalmology used to be one of the #1 admission specialties in all of the fields, and nowadays we can use lasers for procedures like cataract surgery, and the laser can help get rid of astigmatism, which is just the shape of the eye, to give you clearer, sharper vision after cataract surgery. It can also speed up the healing process. We also
Cataract surgery is what? What does it attack?
Right. No, good question. So there is a lens that's in the middle of the eye. You cannot see it looking at somebody's eye unless it's somebody who comes from a third world country who's had that cataract for a long time. But most people, you can't see it. It's inside the eye. I tell patients it's about the size of a small baby aspirin. And when we're 20, 30 years old, it's clear like glass. As we get older, it gets kind of chalky, and then it kind of turns to a yellowish and a brownish color, and it's harder for light to get through it. And as it starts to block the light, it starts to make our vision blurred. And we notice it in all areas of our vision, whether it was distance or near. You know, we all go through that period of life in our 40s where we feel like we can't see up close anymore, and that's a normal change of the eyes, which has nothing to do with the cataract. But as that cataract grows, it clouds the vision, and it makes it hard for us to do the things we want to do. And so when it gets to that point that it's affecting our activities of living, then we look at it and decide if surgery would be an effective means to improve that vision.
Surgery removes the cataracts.
Correct. So
and restores the eye to what its vision was before.
correct. So
I know by way of disclosure, I've been going to you as my eye doctor for a decade now.
Yep.
And I got all excited when you said, I think we've got cataracts here, because I thought you said Cadillacs, and I thought I was going to get a car. But
I hear that quite often, the cataract-Cadillac comparison. But yeah, it's something that we all develop eventually, and nobody's immune from them. I tell my patients I do cataract surgery on 40-year-olds, and I do cataract surgery on people who are in their 90s or even, hundreds once in a while, if it's going to give them some type of benefit. And the neat thing about it is, nowadays it's an outpatient procedure. Surgery itself takes probably 15 to 20 minutes from start to finish. And a lot of my patients go out for dinner that night with their family.
because I remember the old days when you went to the eye doctor, and you got the drops in your eye, you couldn't drive for hours, and your vision was blurred, and just talking about things that have progressed. Now, what's macular degeneration?
So macular degeneration is the leading cause of blindness in the United States. And there are two forms of macular degeneration. There's what we call the dry type, which probably 90 to 95% of people have. And then there's the wet type. And the dry type is where the cells in the center part of our vision start to deteriorate. And we can see certain changes in this area of the eye called the macular. That's where you get macular degeneration. The macula, when you're looking at me, Alan, you're using your macula to see my face. And so it's the very central, most clear part of our vision that we use. And that gets attacked by macular degeneration, and it starts to disrupt some of that central vision.
This is sort of like tunnel vision?
Tunnel vision is more when we lose kind of the peripheral part of our vision. So it's actually the opposite of tunnel vision. Macular degeneration is the center part of our vision. So there are diseases that can affect our peripheral vision and cause us to have tunnel vision. And it's heartbreaking for those patients who have both the diseases that affect their peripheral vision and their central vision, because there's not a lot of in between. The good news about macular degeneration is, again, 20 years ago for the wet type, which is a far more aggressive type of macular degeneration, which I tell my patients, if you're going to choose, which you never would hopefully have to, if you're going to choose, you choose the dry type every time, because the wet is a lot more aggressive. But nowadays we have treatments for the wet type that can slow it and often stop it in its tracks. And so it is a disease that...
Lampalus umba, or some drug similar to that?
Yes. There are drugs that we can inject into the eye, and there's about 3 or 4 different medications that are FDA approved that they can use right now. Actually, there's a macular degeneration specialty groups here in the Twin Cities that do a lot of research on those different type injections, and we're very fortunate in this area of the country that we have such qualified specialists in macular degeneration to take care of our patients with it.
Well, I think we have cutting-edge medicine in many degrees, and of course we also have the Mayo Clinic. So,
Agreed.
you know,
Agreed.
we
Yeah.
really are very fortunate in this area. If you get past the weather,
right. Exactly.
you can do very well.
Exactly. Yeah.
So, interocular lenses. What is that we're talking about?
Yeah. Interocular lenses, in my mind, is one of the most exciting technologies that the comprehensive ophthalmologist and the ophthalmologists who do cataract surgeries have available to them these days. So when we take that cataract out, which is like that baby aspirin that sits inside the eye, we replace it with a new clear lens. And once that new clear lens is in place, you don't grow another cataract. It's a one-time and you're done type surgery.
And this operation can be done in 15, 20 minutes?
Yeah.
Unbelievable.
Yeah, it is pretty amazing.
It really is.
It's come a long ways. I mean, the interocular lenses started.
Is this done in a hospital or is it done in office setting?
It used to be pretty consistently done in a hospital. Nowadays, I don't go to any hospitals. It's done in outpatient surgery centers. And I don't know what % of them are done in outpatient surgery centers, but around this area, I would say probably 70 to 80% are done in outpatient walk-in, walk-out surgery centers. And, there's different options for these interocular lenses, and they're getting better with their technologies all the time. But nowadays, we have interocular lenses that we can put in the eye that most patients don't need to wear glasses at all. It corrects their distance, it corrects their near.
It's amazing.
Yeah, it's pretty cool technology.
Yeah. Now, I have not only prescription glasses, but they're bifocals. But I can also go into a drugstore and for $20 or so purchase glasses. Now, how does one judge? I mean, I've done it, so
Right.
What's the advice for somebody who wants to go the cheap way?
Right. You're not causing any damage to your eyes going the quote-unquote cheap way. A lot of it comes down to the optics that you have in the lenses that you purchase. Now, for people like you, Alan, who can get by with just the over-the-counter readers, I tell my patients that is fine. I mean, I'm the same way. I can get by with just over-the-counter reading glasses as well. I choose to wear progressive bifocals because when I have the readers, like I hear 100 times a day in clinic, you buy 10 pair of the over-the-counter reading glasses, you know where 2 of them are at any one time, and whenever I sit down to read to my 9-year-old, I tell her, go find my reading glasses, and she can't find them either. So I choose just to get a pair of glasses that I can leave on all the time. I don't have to search for those readers that I've either stepped on or sat on or left in a car and ran over them.
Well, these are my bifocals right now,
Yeah.
which
Yeah.
I lose on a regular basis.
I think we all do that.
I have to tell you.
Yeah.
We've talked a little bit about how laser surgery has made things much easier. And we haven't talked about glaucoma, which I know is a big problem. What is it? How do we deal with it?
Yeah, glaucoma is a big problem, and it again has had some exciting breakthroughs over the last few years. Probably, I would say 30, 40 years ago, it was a leading cause of blindness in the United States, and then macular degeneration took over. We do have a lot of better treatments, which has lowered it on the list in the United States, but still worldwide it is a leading cause of blindness. And what glaucoma is there is a pressure inside the eye. The eye is always producing fluid, and it's also draining fluid out of it all the time. And there's a balance between producing that fluid and having that fluid drained out. If it's not in the right balance, pressure can build up in the eye. And we know that that is one of the factors. There's other factors, and we don't completely understand all of them yet. But that is a large factor. And when the pressure builds up in the eye, which sounds like similar to your blood pressure affecting the heart, but the two are completely unrelated. When the pressure builds up in the eye, it can cause damage to the nerve, which is basically the cable that connects the brain to the back of the eye. So when we have light that comes into our eye, it hits that optic nerve, it interprets that information and sends it to the brain, and then the brain tells us what we're seeing. If that nerve gets damaged, unfortunately, with glaucoma, we don't have a fix for it. We don't have a cure for it. So Yet, right. So the key with glaucoma is early diagnosis. Now, the tricky part is that glaucoma is most of the time a symptomless disease in the beginning. You don't feel it and you don't sense it. And what it starts to do is affects our peripheral vision, like you were talking about earlier. And a lot of times it's hard to know that our peripheral vision's being affected. And by the time it gets to our central vision, the cow has kind of not only left the barn, but the street or the
really
county.
By the time you're 40 years old, when you do your annual physical checkup, you should probably also do your annual visual checkup.
Correct.
To
Correct.
stop these things before they get out of hand.
Correct. We recommend people in their early 40s for sure get an eye exam, and then somewhere, depending on their overall eye health, in their 60s to be checked once a year. If you have a family history of glaucoma, I would probably recommend getting your eyes checked earlier than that even, because family history is one of the big risk factors for glaucoma. Mm-hmm. And again, in a disease that you don't feel the symptoms, if we can detect it early, we can get it under control, which usually involves just taking a drop or so a day to control the glaucoma and preventing any damage to your vision.
Now, ophthalmology in the time that you have been practicing has really undergone a lot of, practically a revolution in terms of treatment, in terms of drugs, in terms of everything else, requiring you probably to attend seminars and staying on top of it and things like that. How often do you have to do that?
Well, to continue to have our license, we have to have a certain amount of continuing medical education that comes up basically on a yearly basis. So we are always training throughout the year, whether we go to seminars or talks or do online training. But yeah, you're correct. The practice of ophthalmology when I started 19, 20 years ago has changed quite a bit, and there has been a lot of breakthroughs, but it also requires just keeping up on the general medical knowledge that you need to be able to treat your patients and do the best you can for your patients. So yeah, there's always continuing medical education, whether it's conferences or online or lectures that we go to throughout the year.
What about screening techniques? There are now a lot of new, I understand, screening techniques in ophthalmology.
Yep.
So.
Yep, there are newer screening techniques, and I think the key with the screening techniques is knowing what tests are appropriate for what patients. I don't think everybody needs, and with medicine where it's at right now, and costing more money to the patients as a whole, you want to be careful about balancing what the patient needs to give them the most effective eye care and not doing unnecessary tests that they're going to have to pay for or their insurance might not cover. But
speaking of insurance, does it recognize the importance of medical necessities for the eye and pick up part of the cost of it, just like it does with everything else now?
Yeah. I will tell you the same thing that I tell my patients almost daily, Alan, is that if you're asking me to comment or understand insurance, I'm going to tell you I don't know the answer to any of those insurance questions. What I can tell you is we will fight for our patients if there are tests or medications or procedures or surgeries that they need. I spend, and my assistants help out a lot, a great deal of time getting pre-authorizations or talking to insurance companies to make sure that the patients get the best care that they can.
Now I'm going to break protocol right now and tell you that if you look over your left shoulder, you'll see the man who recommended me to you.
Yes, there he is. There he is.
We don't normally do that, but it was Bill Raker who recommended me to
Bill's a
your
wonderful
office
guy.
years ago.
Yeah, yeah.
And I'm still there, so that says something about you.
I haven't chased you away yet. Yeah.
How has, particularly being president of the organization, weighed upon you in terms of the bureaucracy of it all? Because I know you have to deal with patients. You still do operations. You certainly have to deal with all your other doctors and personnel and technicians, et cetera. And then there's the bureaucracy of insurance. So how does that weigh on you?
Yeah, it does. I still love what I do. I love the practice of ophthalmology, and I love being able to help patients surgically and clinically. I chose ophthalmology to do that with patients. What you aren't trained necessarily for in medical school is the business side and the administrative side and basically the management side of things.
Which has become so important in our practice of insurance-driven medicine.
For sure. It has. And, I say often that I'm a big believer in staying in my own lane, and my lane is the practice of medicine. Now, I understand that I am going to need to be at administrative meetings, and I'm going to need to help out with the staff and help out with processes such as the merger that we went through. But we've also hired great leaders within our clinic that guide and advise me and help do those administrative and bureaucratic positions and decisions that make us run smoothly. And I honestly, in 19 years with the Edina eye physicians and surgeons, think that we're at one of the strongest places we've been since I've been in the practice with the leadership we have, both on the physician side and the administrative side, and the staff we have. We have a wonderful staff that we're very proud of.
What do you do with people like me who can't stand something coming at their eye?
Well, if you were my wife, who is just like you, I refer her to another physician who can deal with that. No, jokingly, I tell patients all the time, whether it's worried about cataract surgery or LASIK surgery or having an eye exam, I tell them that that is a complete normal fear, and we will take our time and do what's comfortable. We will not cause any pain or damage, and most of the time we can talk you through it.
We won't punch you out.
We won't punch you out, that's right.
We've been talking with Dr. Jeffrey Stevens, who is the president of Edina Eye Physicians and Surgeons, and a first-time visit, but I think there's a lot more to talk about in terms of the eyes. So thank you very much for coming in, and we'll look forward to the next visit where we get more involved.
Thank you, Alan. Pleasure speaking with you.